Welcome, everyone, to another edition of the Sports Medicine Update. It's a weekly podcast with yours truly, Jerry Riles, and the incomparable, outstanding Dr. Chad Prodromos. Doc, how are you?
Doing great, Jerry. How about you?
I'm doing fantastic. We've had some excellent weather, outstanding weather, and it's projected to go on to the middle part of next week. So in the 70s as far as the temperatures are concerned. So certainly taking advantage of it and getting the walk in and enjoying the beautiful fresh air and the beautiful fall colors of the leaves changing. So all in all, feeling fantastic mentally and physically. How about you?
Ditto. Likewise.
Well, I can say one thing, Doc. One person who may not be feeling too good physically is our own Mitchell Trubisky with the Chicago Bears, a backup quarterback who just this week we found out that he re-injured a shoulder that he injured back in 2018 in the game against the New Orleans Saints over at Soldier Field. Mitchell Trubisky came in one play, Doc, one play. He was upended for a loss on a third down play, I believe it was. And we found out later this past week that he sustained a shoulder injury. And many of us were scratching our heads on one play. But sure enough, he re-injured a shoulder that, again, he injured back in 2018. Can you tell us, in your perspective, what happened here? Because it's surprising to us. One play and he's injured. He hasn't been out there. Why did this sort of thing? And it didn't seem like it was a freak play. It just seemed like a natural football play, Doc. What happened?
So here's the thing. Football players are prone to three kinds of shoulder injuries. The one he had to his right shoulder in 2018 was an AC joint sprain. So the AC joint isn't the actual shoulder joint. It's a joint between the collarbone and the shoulder blade bone at the top of the shoulder. And when you land on your shoulder, you're prone to get it. So he got that. He missed 2 games, came back. This time, he also landed on his right shoulder. I don't know exactly what he did. I know he saw Dr. Al-Atrash in L.A. that decided he didn't need surgery. So more than likely, there's a good chance that it's his AC joint, or it could just be a bruise or a contusion. I don't think he dislocated it, which would be a whole different kind of a thing. The other thing you can do is tear your labrum, but usually you don't tear your labrum that way. So it may be kind of a recurrence of the other thing, but it's and who knows for him in this scenario, if it's a bad enough one, it might be season ending, but I doubt it is, because if it's a bad enough one, it gets kind of complicated. If it's a bad enough AC joint tear, these days pro athletes usually get surgery, although most regular folks don't. So I think he's played for 4 years. He runs around a lot. The left shoulder injury was far more significant. The dislocation. He had surgery, and apparently he's doing okay. I think for a guy that runs around like him, I don't really think it's a big deal. And it brings up the whole question: well, is he injury prone? Is this a red flag? I mean, it sort of seems like his best future is not with the Bears, but I think that I don't think that injury prone should be one of the reasons why. It brings up the larger question, like, what is an injury prone player, and should this be a red flag? And I'll tell you, it is often the case that people come out of college and they play and they get hurt and they get hurt again. Maybe they get hurt again. And everybody said, oh, they're injury prone. Forget about it. But I will tell you, and I don't have any statistics to back this up, but let's just say that it's often the case, and I want to say I think it's usually the case, that people get hurt maybe repeatedly, but usually they stop getting hurt. And, examples that come to mind, Rex Grossman tore his one ACL, I think it was the other knee or the same one again, I can't remember. And he seemed like every year something was happening. But then after those first few years, he was fine. Another example, Kevin White, fascinating player, unfortunate player, great guy by all accounts, very talented. Everybody knows the story. Number 1 pick by the Bears, and 3 separate times he got injured. Poor guy. However, so he just got in the field last night. The 49ers, he signed to their practice squad this year, and they activated him last night. They had some wide receivers injured. He didn't get a ball thrown to him, but he's on the active squad. And so here's the thing. He's been this year and last year, maybe the year before, I'm not sure, didn't get hurt. So after having an injury like every year, bone injuries, like, oh my God, what's wrong with this guy? He hasn't gotten hurt anymore. So I think, Derrick Rose. Derrick Rose still gets dinged up, but he had those two unfortunate injuries, and he seems to miss time here and there. But so I guess what I'm just saying is this. I think you have to be very careful to label people injury prone. The thought is that if you're loose jointed, it makes you injury prone. But the thing is, people that are really loose jointed usually don't make it to this level a lot of times. So anyway, I feel bad for poor Mitch Trubisky. By all accounts, a wonderful guy. Sure, he's obviously got a future in the NFL, whether or not it's with the Bears. And I think labeling him injury prone probably be a bad rep.
Well, I don't know if it's necessarily obvious a future in the National Football for Mitchell Trubisky, but I guess if you suggest that someone will give him an opportunity, one of the other teams around the league, maybe, but for the most part, Mitchell Trubisky is truly, I believe, what you see, what you get. Dr. Chad Prodromos, Sports Medicine Update, the weekly podcast. A couple things that come to mind regarding injury-prone players, and you touched on a few, but there are a couple other guys that came to mind when you talk about that, and one that sticks out for me, former Ohio State Buckeye back a few years back, Greg Olden. He was projected to be a number one pick coming out of Ohio State, and he never materialized. I don't even know if he got on the court. If he did, it was probably for a game or two, but the reason being are the multiple injuries that kept reoccurring, not only in his collegiate career, but in his pro career, so to speak, whether it was knees or ankles or any combination of that. And he never materialized because he was always physically hurt. And he's the one type of person that you would say, hey, this guy is poor. It's sad because he just seems to be injury prone. I don't know if you recall his physical situation, but players such as that who projected to be outstanding, but injuries continue to become roadblocks and obstacles for him. How do you describe that?
Yeah, you're talking about the 7-foot center, right? Yeah, very talented. So, it's a very good point you bring up. So let me draw a distinction. What happens, and it happens more in basketball, I think, than any other sport. It can happen in football too. And again, I'm not privy to a lot of inside information, but maybe going on with Todd Gurley, I'm not sure. If you have a knee and the knee starts to get damaged cartilage and you shed cartilage, that's a case. It isn't even so much a matter of injury prone. It's a matter of just the tire not having enough tread. And particularly in basketball, jumping sport, those people with chronic bad knees, sometimes, I'm trying to remember the two guard for the Portland Trail Blazers had a fantastic career, like 4 years, and then just couldn't make it anymore. So those kinds of players, I think, once your knees are kind of shot, I don't think usually you get it back. Now, so that's a different thing, torn ACL. You can come back from that, like Derrick Rose did. His ACL hasn't been any kind of a problem. Some players don't. So what often happens, though, so outside of the knee, it would be unusual for a player. I mean, you don't really hear about players getting chronically bad shoulders and not making it. We talked a few weeks ago about the Bears having two people, Anthony Miller being one, Jalen Johnson, the rookie cornerback, being another, that had 2 operations each for shoulder dislocations. First one, re-injured, didn't go well, whatever it was, and they're doing fine now. So eventually, it got fixed. So now it depends who you are too. If you're a pitcher, totally different story. If you're a throwing athlete, if you're Maria Sharapova, she had surgery for her shoulder. And generally speaking, if you're a thrower with a bad shoulder that gets operated, you're probably over. So what I'm saying is this: there can be a key joint, like the shoulder for a thrower, the elbow for a thrower, although the most common serious elbow injury out there is the ulnar collateral ligament tear that results in Tommy John surgery. And, kind of amazingly, the recovery rate from that's pretty good. So, there are certain injuries in certain people where you've got a really key joint. And those are basically it. The knee for Ernie Banks, I don't know exactly what he had in his knees. It was a long, long time ago. But, Ernie Banks, everybody knows, Hall of Fame, originally all-star shortstop, MVP 2 years in a row. I think 57, 58 for a bad team. It's mind-boggling. But anyway, so he got shifted to first base. So, his knees kind of wore out, not enough to be a shortstop, but good enough to be a first baseman. So I think what I'm saying is that there are certain circumstances that maybe your knees get worn out, can't do what you used to do. Now, if you're a basketball, if Ernie Banks is a basketball player, maybe his career would have been over, if you lose that lift and explosiveness. So it kind of depends on circumstance. But what I'm really saying is the player that gets, Kevin White is probably no better example because I don't remember exactly what they were. His first year, he had a stress fracture of his tibia. I know he suffered a fracture of his scapula, shoulder, and I can't remember what the third one was. But they were different, And so the thought is, does this guy just got a weak body? But he's been pretty much fine. So I think if you've got a particularly disadvantaged joint, Greg Oden with his knee, the other Portland Trailblazer I'm thinking of, it's, that particularly in the, that's one thing. And once you get attrition of cartilage, the cartilage coats the bone, and once you lose enough of it, then a lot of times it just, doesn't function like it did. And again, if you're a baseball player, maybe not that big a deal like with Ernie Banks, but if you're a basketball player where you need lift, or, where if you're a skilled football guy and you lose time off your 40, so, but I don't think there are too many people out there that get hurt, and then they're just injury prone, forget about it. So I think sometimes, so again, maybe it's an artificial, fine distinction, but a distinction between injury prone in general versus a particular joint that's just kind of trashed.
Hey, real quick, before we transition, I wanted to get back to Mitchell Trubisky and the shoulder injury. And you talked about the AC joint. Can you paint a picture for those who's watching and those who may be listening as far as in the shoulder, where that AC joint is and what's the purpose, how it works for you?
Yeah, well, and in fact, I don't know if you can see too well, but this is, apex of my shoulder. So the AC joint, if you go to the apex of the shoulder and go in a little bit, so it's the top of the shoulder, that halfway visible, right about there, right exactly on the top. And if you feel there's a bump there, and the little bump on the top of your shoulder, it's more visible in some people than others.
Right.
And if you go, left to right, you can kind of fall off that little bump. So the bump is the end of the collarbone. The collarbone starts, in the midline, attached to the breastbone, goes out here, and then it attaches. So that's the C part of it, the clavicle. The A is the acromion. If you keep going out a little more, there's this other hard bone just outside of it. That's the acromion. That's part of the shoulder blade. So the AC joint is where those two meet. And if you land on your shoulder like this, what happens is that there are ligaments. The collarbones go outward and serve as a strut from your spine, basically, to hold your shoulder blades up. And then your shoulder blades hold your arms up. So if you land right on it like that, hard, the ligaments that hold your shoulder blade up to your collarbone can get ruptured, and that's an AC injury. And it's kind of an interesting injury. So you can sprain it, which is what he must have done, Mitchell Trubisky, in 2018, because he only missed 2 games. So you can sprain it, it's sore and it gets better. But you can also tear the ligaments. And when you do that, the collarbone looks like it's popping up in the air. Actually, the collarbone's not popping up. The whole shoulder blade's drooping down. That's a grade 3 separation. So in that case, it looks peculiar. It hurts, and it looks peculiar. And I see patients with it. The first thing they say is, well, geez, doc, how are we going to fix that? The truth of the matter is, maybe a little different for a thrower, but for most regular folks, you don't need to fix it. And I'll tell Luke Longley on the Bulls. Australian free spirit, suffered a complete sprain of his AC joint, or so it said in the paper, surfing in Australia. Mm-hmm. And basically, it looks kind of funny, but you wear a sling and the pain usually goes away. When I was doing my fellowship at Harvard, we were taking care of the New England Patriots, and actually right around that time, not the year that I was there, but Tony Eason's quarterback there, University of Illinois product, everybody remembers. So Tony Eason sustained one of these, actually he wasn't treated surgically. He was treated with a sling to hold it up, and the sling resulted in a little nerve palsy. Eventually, it was okay. So the point is that for most regular folks, you just leave it alone and it does fine. You just have a funny looking bump. For reasons that are not totally clear to me, among my shoulder specialist colleagues, people are now doing surgery on it. And the thought is that if you have a high demand shoulder, maybe you need to, or you get symptoms. In my experience, I've never operated on one. I've told everybody that I see, leave it alone, it'll get better. A good friend of mine was a former Olympic wrestler and got one of these and came in with a bump, and he goes, "Oh my God, when are we going to fix it?" And I said, it was Pete. I said, "Hey, Pete, leave it alone. It'll be fine." And he goes, "What? You're kidding me, right? I got this big lump. You're going to leave it alone?" I said, "Trust me." So 3 weeks later, he's feeling better. 6 weeks later, he's fine. No issues. So that's the AC joint. And if you grade 1, grade 2, you sprain it, it gets sore, it heals. Grade 3, these days, particularly, if it's the right shoulder of a right-handed thrower, you can make a case for fixing it. But I'll tell you, the surgery to fix it is not benign. There's no good. It's a long story, but the lever arm of your shoulder blade pulling down your clavicle is huge forces. So operations to fix it have a fairly high failure rate. Nobody agrees on how to do it. People put plates and screws and other stuff. So the good news is, if you're a right-handed thrower and you get a complete sprain of it, maybe it's worrisome. But, Luke Longley, I don't know if it was his dominant or non-dominant hand, actually. But he, by all accounts, did just fine with it. So in general, you wait for it to get better, and it goes away. There's another thing that's related to it. So that what I talked to you about is an AC separation. It's actually a dislocation of the acromioclavicular joint. It's commonly called a shoulder separation to distinguish it from a shoulder dislocation, which is a dislocation of the ball and socket, the ball from the arm and the glenoid main socket, which is what happened to Mitchell Trubisky's left shoulder and happened to Jalen Johnson and Anthony Miller's shoulder. So people commonly call it a shoulder separation because then it's just to distinguish it from a shoulder dislocation. So sometimes the terminology gets confused. But the other thing can happen is the AC joint, even if you don't have trauma, can get to be painful. And it tends to get painful if your arm is crossing across your body like this. And so where does that happen? It can happen with repetitive motion, but it can happen with people who lift weights heavily. Because if you're doing a bench press, bringing your arms forward, this joint pistons together. So that is often treated with an injection. If the injection doesn't help, you can shave down the end of the bone, and that's usually curative. I see it sometimes in big, strong linemen who lift weights a lot, that kind of thing. But that's not a traumatic thing. It's a gradual thing. So, yeah.
No, that very good information, Doc. There's no question about it. Running short on time. It is the Sports Medicine Update, our weekly podcast. Dr. Chad Prodromos, yours truly, Jerry Riles. We can transition and segue before we're out of here. You talk about offensive linemen. Well, as you well know, and I'm sure a lot of people watching and observing this podcast, following the National Football League, a lot of news locally here in Chicago. 3 offensive linemen for the Chicago Bears tested positive for COVID, and the facilities, Hallis Hall, was actually closed down on Thursday of this past week. Due to the cases, and we know that numbers here in Illinois, we've hit record numbers as far as one-day cases are concerned, and I believe nationally we hit over 100 and 2,000 cases in one day. So it's affected not only mainstream America, but of course the world of sports. And 15 teams at this podcast, the time of this podcast, have reported cases of COVID from whether it's players or front office people or a combination of the two. 15 National Football League teams have tested positive, and the league is coming down hard on a couple of them. I know the Pittsburgh Steelers were fined heavily, and of course the Oakland or Las Vegas Raiders were hit heavily as well, with the possibility of losing some draft picks because they did not follow the protocol. Are these numbers alarming to you? And I know we've gone back and forth and we've talked about it, whether it's on the collegiate level, where we've seen the cases spike up. We've seen it on the high school level here in Illinois, the battle between there. But now it's affecting the National Football League. Again, at least 15 teams have cases. And, we're here at week 9. Again, for those who may not be aware, Doc, your perspective on the increase and the rise of numbers regarding the cases of COVID.
Yeah, it doesn't concern me at all. The real truth on this, in my opinion, as I've mentioned before, is the Great Barrington Declaration or Great Barrington Proclamation. I would encourage everybody to look it up. It's not Barrington, Illinois. It's Barrington, Massachusetts. 3 very smart doctors, one from Stanford, one from Oxford, one from Harvard, got together and said we should do 2 things. We should let young people, low-risk people, live their life. If they get it, they get it. Don't worry about it. Breeds herd immunity. But be hyper vigilant to protect those with high risk. So, if you've got a team and a majority of the people get it, thankfully, we haven't really seen major problems by and large with these athletes. Almost all of them are going to get well, and the risk is extremely low. Lower than the flu for young people. So it's actually kind of a plus. I mean, the more people that get it in a given environment, the less it's going to spread if somebody else gets it. So should everybody just go to a COVID party and get it? I mean, to tell you the truth, you could make a case for that. I think it's seen as extreme, and I'm in no way advocating it on the one hand. On the other hand, what would be a horrible mistake to make is to say, oh my goodness, more people have gotten infected. We're having to play this week without, several people at one position. Let's just pack it in. That would be letting the virus win. The one thing that is key, the worst thing about this virus, I think, is what it does is bad, but the secondary effects of the lockdowns, I think, are worse. And to lock people, to just punt on the NFL, it just shouldn't happen. They should just do pretty much what they're doing. Just play. And if people miss time, they miss time. Because in time, we're all going to be immune. The more players that get it, the quicker they'll get immune. And then there'll be a vaccine here at some point. But just persevere. And if you have to postpone a game here or there, fine. Just persevere. You cannot sacrifice society because it's sort of inconvenient that, this team's going to have to play without a few people. So be it,
Well, and we saw that again Thursday night. We saw the Green Bay Packers. They defeated the San Francisco 49ers 34-17, but we do know the 49ers team was depleted. A lot to do with the COVID that ran rampant through the organization, and so they were without a lot of players in that lost to the Green Bay Packers. But the argument, Doc, that many are saying as far as the front office and the NFL is that, okay, we look at it and, with the 53-man roster or however many players that are on the roster, practice squad and all that, you got a mixture and a diversity of players and dynamics. And we talked about offensive linemen in the past and, what's important for them to stay healthy and be able to, offset injuries as well as fight the pandemic. But the argument being posed out there, presented out there by the league is the fact that you got some 20-something-year-old kid, right? And you were there once, I was there once, where our kids, and, the 20-something-year-olds are, they feel invincible, and that they can take on life and overcome everything. But you have teammates in the same locker room who are in their early to mid 30s, and they're a little bit more settled in their life, and they may have a young family. They may be with some elder people in their life, and so the argument is these young cavalier rebel type of young kids in the 20, 21, 22 years of age are bringing this virus in, and then the 32, 33, 34-year-old something guy gets infected, and then he takes it home, and it causes so much there. How do you defend that position?
It's very simple. The 20-year-olds, nothing's going to happen. I mean, there may be an outlying case here and there, but that could be true of anything. But nothing's going to happen to them. Nothing's really going to happen to the 30-year-old either. There was the one case I referred to before of an unfortunate young gentleman who was listed at 6'3" and 355, Division II, who passed. So, I've mentioned before, people who are really big, maybe they shouldn't be playing. But it's pretty simple. If you're young person, young bachelor living, whatever, with a young lady, something like that, don't worry about it. If you're a player in your 30s, and you've got a wife or a girlfriend and young kids, don't worry about it. The case that you posited, if you're a player in your 30s and you're living with your 80-year-old diabetic, hypertensive father, then they should do, in my opinion, one of two things. The one is, and these, make other arrangements, living arrangements for that person for the time being. I mean, and if we're talking about the NFL, I think the finances are available for people to do that, or stay away. Eddie Goldman made a decision not to play, and I don't know all the reasons why, but I know he's listed as asthmatic, so he might have felt he was at increased risk, and he probably is. So if the and you hit the nail right in the head. It's not you, and it's not your kids, and it's not your wife or girlfriend. It's the older person that you're coming in contact with. So either don't come in contact with them, at least during the season, or don't play. But to shut down the entire operation because of those people, when a good option exists for those people, right? I mean, they don't have to play if they think they're at risk. Or maybe, there again, all right. So you have a 30-year-old. And so how old is their father or mother going to be? 50? 60?
Depending, yeah.
So 50 or 60. So I'm 66, right? And if you're 60-year-old male, a 60-year-old male who's in good shape, I'm not worried about it, honestly, is a pretty low risk. So it could be their parent, could be 50, could be 60 if they're in good shape. And if they don't worry about it, then I wouldn't worry about it either. But to your point, if there is somebody at high risk, either have them not be in the household with you or just don't play. But that's a small minority of people.
Yeah, but it's hard. It's easy for us to say, but the reality of it for these players, Doc, is the fact that they only get game checks in the season, and they get the game checks every week for the most part. Every game that they play, they get a game check. So many of these guys, they count on this money year round, and so it's not that easy for them to miss a game because they want to protect themselves and protect their loved ones.
Well, then they should play, and then they could make arrangements for their mother or father to be someplace else. And by the way, if the alternative is shutting down the league, then nobody gets paid.
That's exactly right.
Right. So I don't think you want to do that. And the people you talked about are a small percentage of people. Maybe the league helps them. Maybe the league makes tremendous money. Maybe the league finds a way to find living arrangements for people. I mean, you can always do that. You can find living arrangements. It's just a matter of finances, and these guys are not poor.
No, I mean, they're not poor on our standards, but this is money that, this is another topic for another day. But a lot of these athletes, it's unfortunate they don't have the management skills as far as money is concerned, and they think that this money is going to last them a lifetime, and that's just simply not true.
Well, the league should help. The union should help. I mean, we're not talking about a complicated thing here. The alternative of shutting down the league makes things drastically worse, right? So you deal with the people that have an issue, and you help them, and we're talking about them living in some other kind of a facility, or a few people don't play, you know. But shutting down the league and just saying punt, and I'm not saying you're saying this, but
No.
But it's imperative to keep it going. Really, Jerry, it's an allegory, in my opinion, for the schools the same way. You know, you take the people that are low risk and let them come, and then the people that have multi-generational homes, or the people that are at high risk or high risk teachers, then you make accommodations for them. But have life go on, and just make accommodations in that circumstance.
Well, I think the league has done, the National Football League has done a very good job in trying to control this. And unfortunately, just like society, the numbers are starting to escalate. And
Jerry, I got to interrupt you just one thing. I'm sorry.
Yeah.
You're right. I totally agree. But bear in mind, and I've said this every week as well, don't look at cases. Look at hospitalizations and look at mortality. And those are not going up, right?
Well, but that's part of the argument. Some of the medical facilities around the country are saying that the numbers are going up in the hospitals, and some places they don't have enough ventilators to.
No, that's not true. That's not true.
I don't know.
There's no shortage of ventilators. There's no shortage of ventilators. No place is getting overwhelmed. Forgive me.
I don't know if it's true or not, but I'm only going on the data that's presented. And from the league's perspective, Doc, they want to do everything possible in their power, I believe, to make sure that they're this and the cases, regardless if they're accurate numbers or not, they don't want the numbers to go up. And so that's why they instituted fines. And again, I mentioned the Raiders and the Steelers. I think John Gruden was fined $150,000 because he ignored the shield, and Mike Tomlin with the Pittsburgh Steelers get hit with $100,000 fines because he didn't take control of his players and the mask and everything. So the league, they're doing everything in their power to make sure that.
I agree. I agree. So, I think the league's doing a great job, to be clear. I think they're doing a great job. My only point is, while it gets a little frustrating, the thing to do is just deal with a little frustration of people being out and keep going. That's all I'm saying. But no, I think they're doing a great job.
I think they're doing a great job, and unlike the NBA and the National Hockey League, they were in bubbles. The NHL was up in Canada. We know the NBA was down in Orlando, and the bubble was superb almost. Major League Baseball, we see what happened there, and of course now the numbers are starting to rise as far as football is concerned. All in all, Doc, it's again, if we stated this before, we're all in this together, and I don't know if anyone has the right answer. But I'm just, as a selfish fan, I'm pleased that we have reached Week 9 of the National Football League, because
totally agree.
And the fact that we're playing college football, because now people have something to look forward to as far as entertainment is concerned for the weekend. And of course, the Masters are coming up in golf, so it gives people some type of release.
Absolutely.
Type of, relieve the stress in their lives, the daily lives. But hey, it's always a pleasure, and I know it's a stickler for people, but it's something that we certainly have to address every week moving forward, because it's affecting not only our personal lives, but it's affecting the world of sports, the world that we love so much here in this great country we call the United States of America. Hey, Doc, if anybody wants to get a hold of you, how do they find you?
Our office phone is 847-699-6810. We've got a great staff. You get a live person if you call. Email is just ortho, like orthopedic ortho, at ISMOC. It's Illinois Sports Medicine Orthopedic Center.net.
It's the Sports Medicine Update with Dr. Chad Prodromos. Hey, Doc, let's enjoy this time that we have as far as the temperatures are concerned. Our old buddy on WGN Channel 9, Tom Skilling, said we're 10 to 25 degrees above normal for the next few days. So let's get an opportunity to get out there and take advantage of it and enjoy it.
For sure.
We're hearing that the winter is going to be pretty tough, so we don't want to think about that. Doc, thank you so very much. Always a pleasure, and have a great week, and we'll talk to you next week.
Thank you, Jerry. You as well.
You're the best.